Hi, everyone. Good afternoon. I'm Komal Nayak. I'm a child and adolescent psychiatry fellow in the Department of Child and Adolescent Psychiatry at Hassenfeld Children's Hospital at NYU Langone. And just wanted to welcome you to the webinar. I'm excited to talk to you a little bit about marijuana today. It's a topic that's obviously receiving a lot of attention in terms of media, politics, and just socially in our classrooms and in our homes. And so since the topic is so broad, I will try to focus on a few points that I think may be helpful to know. And just a reminder, you can submit questions at any time today by typing them in to the questions pane of the control panel. That's on the right side of your screen. We'll answer questions at the end of our presentation. All right. So a few things that I'll be covering today. Review statistics on early marijuana use, examine the consequences of early marijuana use, and discuss some strategies that parents can utilize to speak to their kids about marijuana. So what is marijuana? Let's start there. Obviously, just socially in schools and music and movies, internet, we hear it as pot, grass, Mary Jane, widow, hash, reefer, different terms like that. Formally, it's part of this plant family, Cannabidiol, and probably the most common species that is used is Cannabis sativa and Cannabis indica. And marijuana specifically refers to the seeds, buds, flowers, and stems that can be smoked or ingested. Because there's also, for example, hemp, which is kind of a different form of marijuana, and that can be used in clothing and different bags, and sometimes can be incorporated in, it was a big agriculture market many years ago. So specific strains that are the most common, Cannabis sativa and Cannabis indica. Cannabis sativa strains, people often say that they're that they make you feel euphoric, make you feel happier. Sometimes people say it makes them feel less depressed. They feel more comfortable, more confident, more open. Oftentimes you'll hear teenagers or college students say they feel more comfortable socially at parties and social settings. Indica strains are known to be more relaxing, sometimes more sedating, and people say that it helps them with their anxiety and nervousness, helps them sleep. And hybrid strains are a combination, and those aren't really found in, those are made in the lab or made by growers and cultivated. Sativa and indica strains are more naturally found in the environment. Sativa strains, for example, centuries and centuries ago were grown in tropical environments, and marijuana was first found, they say, in around 3000 BC in Asia, in China. So specifically, cannabis has over 100 compounds that are chemically related to THC, which is delta-9 tetrahydrocannabinol, which is the most common and most psychoactive substance in cannabis, and probably the most studied as well. And again, there are so many cannabinoids that have not been studied and have not been isolated, and there needs to be a lot of research done in that area. Some other cannabinoids that researchers have found are cannabidiol, also known as CBD, and cannabinol, also known as CBN. And cannabidiol is interesting in that there is some research going on right now to study the effects of cannabidiol to help treat seizures, to help treat pain, to help decrease inflammation, and researchers believe there may be some therapeutic effects. But keeping in mind, marijuana at this point in time is federally illegal, and so it's still a Schedule I drug, and so that poses a lot of obstacles in terms of research funding, access to product and research, and really answering a lot of the questions that I have about cannabis and that you have about cannabis, and I think in general clinicians have and parents have about cannabis and its effects. So there obviously needs to be a lot of research done, and there's a big push to change the scheduling from a Schedule 1 to a Schedule 2 drug, so that it would be a little bit easier. However, a lot of researchers and scientists and policymakers are worried about that because of the potential for increased use and kind of the unknown and what may happen if there's easier access. So different ways that you can use marijuana: edibles. You'll hear kids or adults talking about brownies and candies. There's oils now, CBD oils, cannabidiol oils, for example. People say that helps them with inflammation, healing. There's candies, cigarettes, pipes, blunts, and so there's many, many ways in which you can consume it. The popularity of edibles has really increased over the past decade, and what's interesting about edibles is that they take longer to digest, obviously, but also it takes longer to produce the high that one may get from, smoking marijuana. That high may come a lot more quicker, and so sometimes what happens is people will eat an edible and expect effects right away, and then eat some more and eat some more, thinking that the effects aren't coming, it's not working, and then all of a sudden you may start having symptoms, but at that point you've consumed a lot, and sometimes the potency is higher. So the potency of THC can be higher, which is that psychoactive part of cannabis, and then at that point you've already consumed these edibles, and it's harder to get out of your system so quickly, and now you have a lot of these. You may have some side effects. You may feel paranoid. You may feel hypervigilant. Your heart rate may be up. Your blood pressure may go higher. So that's something to keep in mind about edibles, which is a little bit different than when you smoke cannabis, and sometimes you feel the effects a lot faster, and that way you can modulate your use a little bit more. Obviously, another thing, higher THC levels also mean a potential greater risk for addiction. People are exposing themselves to higher doses and higher potency at a younger age, especially. So some statistics I just wanted to go over. Marijuana is the most commonly used illicit drug in the U.S., and I have illicit in quotes because, like I said, it is federally illegal. It's the third most common substance used as well after alcohol and tobacco. The most common route of administration is inhalation. But like I said, edibles is on the rise. In 2015, more than 11 million young adults aged 18 to 25 used marijuana in the past year. And as of 2016, about 1 in 3 Americans have used marijuana at some point in their lifetime, and I expect that number to probably just get higher as policy and law changes in various states. About 19% of teen drivers report that they have driven under the influence of marijuana at some point. And there's a lot of, well, maybe not a lot, but there's been some movement and in certain police departments and communities to try to figure out ways to, pick up on drivers that are intoxicated, kind of like a breathalyzer that they have for alcohol, something similar. And people who use marijuana prior to the age of 12 are twice as likely to experience a mental illness compared to those who first use marijuana at age 18 or older. So this Monitoring the Future survey is a survey that's done every year across the country, and it was started in the 1970s, and basically it's a survey that's administered to all high school students across the country. And this kind of summarizes some of their findings up until 2015. Here you can see the percentage of students in grade 8, 10, and 12 who report that they used marijuana in the past 30 days. And sometime in the 90s, 8th and 10th graders, you could see here that they started using marijuana, and 12th graders have been using for a while. and kind of how the prevalence has changed over time. And in 2015, you had over 20% of 12th graders that had used marijuana in the past 30 days. And again, this is just a very small snippet of the survey, but the survey also has statistics on other drug use, cigarette use, and also not just marijuana use in the past 30 days, but day-to-day use and how many people have only used once in their lifetime and other such statistics. But it's interesting to see the trend and the fluctuation in use. So as you may all know, Americans overall, over the past few decades, there has been an increase in support for legalizing marijuana. And in 2017, about 64% of Americans feel that marijuana should be legalized in some way. And this was a Gallup poll. And of course, medical versus recreational, those are finer details. But as you can see, that there is an increase in wanting to legalize. And here you can see the map of the states, and that a lot of West Coast states have legalized recreational and medical marijuana. And there's about 9 states that have legalized both, and 29 states that have legalized medical marijuana. And out of those 29, 9 have also legalized it recreationally. So I think that's a really big change over the past few decades. So how marijuana works. Obviously, it affects various parts of the body and the brain. And I'm going to go into a little bit of details on how that works. And here you can see the eyes, the brain, the heart, stomach, kidneys, your GI tract, your bowel movements, your skin. So I'm going to get into some of that now. So how does marijuana, or maybe more specifically THC and these different cannabinoids in cannabis interact with our body? There's a system called the endocannabinoid system, which was only really discovered in the 60s or 70s, and which is really fascinating because obviously marijuana has been around a lot longer, but scientists and researchers were not able to figure out how it actually creates its effect. And what they found was that we actually as humans have endogenous cannabinoids, which means within ourselves, within our body, within our brain. And the two most well-studied endogenous cannabinoids are anandamide and 2-AG. And they found that these cannabinoids within us, they were binding to this endocannabinoid system, which included CB1 and CB2 receptors. CB1 and CB2 stands for cannabinoid receptors that were found in the brain and the immune system, respectively. So CB1 receptors are more pronounced in the brain, and CB2 receptors are more pronounced in the immune system. And they found that anandamide played a biological, natural role within us in regulating mood, memory, appetite, pain, cognition, and emotions, which obviously covers a lot of things, but that it is involved in these complicated pathways that go on in our bodies. And that 2-AG had a bigger role in the inflammation process and the inflammatory pathways in our body. So like I said, THC, which is an exogenous cannabinoid, which means outside of our body, it's coming from cannabis, this external source. And like I said, it's the most studied active cannabinoid. They found that THC was similar in chemical structure to anandamide. And this similarity in structure allowed the body to recognize THC and alter normal brain communication. And in the reward circuit, you have this increase of dopamine, which makes the feelings of the process and use of marijuana more pleasurable. And that THC binding to CB1 receptors specifically is what causes this feeling of being high. And so here you can see several brain structures on the left: the amygdala, the basal ganglia, the brainstem, the cerebellum, hippocampus, hypothalamus, nucleus accumbens, which is our reward and center, and pleasure center, and the spinal cord. All of these areas in the brain have been shown to have cannabinoid receptors, part of this endocannabinoid system. And not only is anandamide interacting with them, which is part of within us, but THC and other cannabinoids coming from cannabis are interacting with these receptors as well and affecting the natural pathways and natural processes that anandamide is involved in. And so, for example, just to pick a few, the hippocampus, which is important for retaining information, learning, memory. If you use THC, maybe that's why some people have an effect in their memory. And for the amygdala, which is like our fear center and emotions. And sometimes people that are using THC feel paranoid or more anxious or more panicky. And maybe that's because they're interacting with receptors in the amygdala and the brainstem. So the effects that people say marijuana helps, and researchers have verified this, that it decreases symptoms of nausea. And so there are receptors in the brainstem that work to affect that pathway. So it's really fascinating because they really only found this system over the past few decades, and it's obviously involved in a lot of important pathways and processes. So more specifically, what is adolescence? It's kind of this paradox. It's just increase in physical and mental abilities. Kids are developing at a faster rate. They're going through puberty. They're growing. They're getting smarter. But there's also this other part of it, which is that they have a harder time controlling their emotions and sometimes controlling their behavior. And we know that adolescence is a period of time with high rates of suicide, accidents, substance use, and other reckless behaviors. And there's this increase in risk-taking and sensation-seeking. And adolescence here, I'm using that term, and the definition for it that I'm using is this period between sexual maturation and the attainment of adult roles and responsibilities. I think for the most part, it has been debunked that adolescence really ends at the age of 17, and once you turn 18, you're now an adult. I think legally and in society, 18 is a special age, and certain laws and rules change, but in many ways, they're still adolescents. And we know for sure that the brain is still developing during this time. Here you can see different images of the brain, and specifically the prefrontal cortex, which I'll be focusing on a little bit, that's still developing. And understanding the teen brain is helpful when talking to your kids, and understanding that the adolescent brain is not fully mature. We know that the prefrontal cortex is under development until about 25, and there are certain metabolic activities and synaptic pruning that's going on that occurs in our brains beyond the teenage years. And this part of the brain is responsible for planning, processing, organizing, reasoning, abstract thought, impulse control. And so that can help us understand why sometimes teenagers may have difficulty controlling their emotions, their impulses, their sensation seeking. They may be more risky. They may have poor planning, poor judgment. They can't really think about the consequences of their actions, especially in the moment when they're forced to make a decision. Do I, don't I? And we know that the CB1 receptors are prominent in the prefrontal cortex, and it plays a role in neurodevelopment. So the earlier that you use marijuana and the more frequently you use marijuana can definitely disrupt some of these developmental processes. So we know over time, this kind of shows in grade 12 students over the past few decades, that the perceived risk of marijuana use has decreased. And I think that's maybe even outside of 12th graders, just even for adults and even for younger kids, the risk of marijuana in society and the perception of it has really gone down. And subsequently, the use has fluctuated, increased, dipped at times. It's remained steady over the past 2 years. But it's important to understand that your child or your student or your sibling may not think that marijuana is dangerous, and that perception really does influence behavior in many ways. We also know that over the past few decades, marijuana has become more potent. This is a graph from the DEA, the amount of cannabis that they've seized over the past from 1995 to 2012, and they measured the potency of THC, and as you can see over the past few years that it's really drastically increased. And what does that mean? It means it's more potent, it's stronger, potentially could have more side effects. Potentially you could use less to have the same effect that you may be seeking as well. So what are some adverse effects? Effects of short-term use, like I said, impaired short-term memory, making it difficult to learn and retain information, motor coordination, judgment. High doses, you can feel paranoid, hypervigilant, maybe, and sometimes have psychotic symptoms. What are some effects of long-term or heavy use? Obviously, addiction is probably one of the biggest concerns, and that's really a topic in and of itself. Like I said, altered brain development, poor educational outcomes with increased likelihood of dropping out of school, and when you're using frequently and in the short term, there have been drops in IQ, and there have been some studies showing that if you stop smoking at a young enough age, that those IQ points will bounce back. Diminished life satisfaction and achievement, and the asterisk basically is showing that the effect is strongly associated with initial marijuana use early in adolescence. So as you can see, most of those points are for the long-term use. So the earlier you use, the more frequent you use, the more likely you are to have some of those long-term effects. And again, what we do know about adolescents is that it's a risky time, and it's this danger zone period where teenagers are experimenting and more likely to start using substances. We also know that heavy marijuana use is linked to lower income, a greater need for socioeconomic assistance, unemployment, deviant behaviors. And of course, some will say that that's probably the case with a lot of other substance use as well. And that's maybe true. But again, what's interesting is the perception of risk of marijuana use is lower. Kids tend to know that if you drink alcohol every day, it's not going to be good for you. If you do heroin every day, that's not going to be good for you. If you're doing cocaine every day, that's not going to be good for you. But that perception of risk is not as high with marijuana. So how to talk to your kids about marijuana? Why is it challenging? It's challenging because every child is different, and every parent-child relationship is unique. Everyone's interpretations of a conversation may go differently as well. And it can be challenging to get your point across and have an open conversation with your child when you're feeling nervous or scared as a parent or as a teacher, and you want your child to be safe. And, as a clinician, I think I want my patients to be safe, and you want them to make good choices. So it's a very difficult conversation to have. Curiosity, peer pressure, the desire to fit in with friends are common reasons kids turn to substances in general, but I think more recently are trying marijuana. And we do know that those who have already begun to smoke cigarettes or use alcohol or both are at an increased risk of marijuana use as well. And people who have untreated mental health disorders or have experienced significant trauma are also at an increased risk of long-term consequences of marijuana use. So what are some strategies that parents can use? Obviously, there's no magic statement, there's no magic bullet to figure out, there's no perfect script that I can give you to tell your children. But what we know for the most part is that kids want to do right by their parents, even though it may not always seem like it. And we know that bombarding them with information and facts and statistics is probably not going to be helpful. The truth is they're pretty smart, they're pretty bright, they're pretty well read. They may know more about marijuana than you know. And it's not really a competition, and it shouldn't be a power struggle. But because what we know is that by bombarding them with that type of information and stats, it may make them more educated, but it may not necessarily change their behavior. What we want to try to do is try to understand that their emotions, their reasoning, their sense of judgment is not fully developed. And I think that's a conversation that you can have with them. Understanding the teenage brain, understanding a little bit about development, understanding a little bit about where these receptors are located and why you have the effects that you have, whether they're positive or whether they're negative. And, you know, we do know that from a parent standpoint that authoritative parenting is always effective. And what I mean by that is being empathic, but trying to be clear with expectations. Sometimes saying no may not work. You can't do this. You're not going to do this. Yes, that may work for a lot of children, and that may not work for many. And so with this authoritative style of parenting, you can be empathic, but you have to have clear expectations with them. So, and that can be learned through different books or parent management training, through therapy, but it has shown to have more positive outcomes. And what I mean by clear expectations is that what are some goals that you want your child to attain and achieve? You know, maybe having a conversation about all the positive effects and all the negative effects of potential marijuana use is too much information. You need to be concrete and be focused on one thing at a time. And it has to be an ongoing conversation. You have to be open. You have to be engaged. It's a topic that you probably will have to come back to over time as policy changes, laws change, legalization changes. You have to be open. You have to be engaged. Try to make that emotional connection with them, and explore the what if questions with them. So what if you get caught driving under the influence? What if you become dependent on marijuana? What if your grades start dropping? What if you spend more time seeking how to get marijuana rather than looking for a job? Get them to explore those what if questions, because that will get them to think, and that will get them to be more meaningfully engaged and really think about their own life and the outcomes and their choices and how it's all related. Because like I said, the brain is not so developed that they can think about all of those steps sometimes. I mean, many kids can, but a lot can't. And role play, practice refusal skills in situations, so that when kids are put into social situations where they feel peer pressured or feel awkward, feel uncomfortable, they're not just going with their impulses and their gut reaction. And they remember that conversation they had with you or their siblings or their teachers. They role play, they practice, they have 10 different answers for when that scenario comes up in their life. And it's not the first time that they're experiencing that situation. So they have some practice. Offer rewards they can earn as a way to limit exposure to risk. And, punishment is not really the go-to. Yes, sometimes it's needed, but you really want to try to rewards, consequences, and acknowledge to them that the risk may be low, but consequences can be severe. Emphasize ultimate outcomes. The longer, and I like this phrase, dare to delay, and I learned about it at a conference that I went to. But really, if the longer that you can delay exposure to substances in general, but specifically marijuana, the better their outcomes will be. The longer they hold off, the more likely they'll be able to make better decisions, more well-informed decisions about their own life, their health, and marijuana use. So I think these are some resources that I wanted to include, some websites that you can look at, and I think it's time for some questions. All right, so how do you know when your child is using marijuana? So keeping in mind that every child is unique and every brain is unique, and every child is unique also in that their family background, what's their family history of addiction, of marijuana use, of mental health, what is the child's history, mental health, socially, are they being bullied, grades, academically, intellectually, do they have some developmental disability? So keeping all of those things in mind, but maybe so that's kind of a unique thing to keep in mind. But in general, things that you'll notice, decrease in motivation, maybe certain smells. Are you smelling it in their clothes, off their breath? Their appetite, changes in their appetite. Are they eating more? Have they put on weight? A drop in their ADL, so activities of daily living. Are they more or just less interested in things like that? Are they not keeping up with their hygiene? Self-care? Are they noticing changes in mood? Teacher reports. What are teachers noticing? Are they engaged in class? Falling asleep in class? Skipping classes? How are their grades? And so these are things, they're really general because there's no telltale sign. Obviously, you can do a urine drug screen, You can see if there's marijuana in the urine, and there are home kits, and you can get, if you go to your pediatrician, during your routine lab work, you can get a urine drug screen if you're really concerned. But there's no one specific way to tell. But at that point, if you're noticing those things, you really want to maybe go to a specialist, go to your pediatrician, go to your psychiatrist, go to a counselor, somebody at school, and then get the assistance that you need to figure out what is going on. Because it may be marijuana use, but some of the things that I mentioned could be a depressive episode, could be that they're getting bullied. It could be that, they're having, they don't have any friends, or they're not understanding the material in school. They don't understand things in class, so they're keeping more to themselves or less motivated. They're not interested. So there could be a lot going on. You really have to tease it out. And at times, it's multiple things. So we do know that when kids are using marijuana, they're often more likely to have depressive disorders, anxiety disorders. And so you really want help and as many eyes as you can get on your child to figure out what is going on. How does marijuana affect memory? So, like I mentioned before, chronic marijuana use, which means almost daily use, the earlier you use, so most studies show before the age of 17, and the more frequently you use, so like I said, every day or at least 4 to 5 times a week, you're more likely to have long-term memory changes and effects. And also synthetic marijuana, which I haven't really touched upon, like K2, definitely show long-term memory effects. What do I mean by memory effects? So difficulty learning things and retaining that information. Difficulty changing, so there's different types of memory, short-term, long-term, and the processes that memories go through to become consolidated in your long-term memory. It's really complicated, and we do know, like I said, that there are CB1 receptors involved in those pathways. The hippocampus is one of the major regions of the brain that's involved in memory. And so, like I said, if you're using at a younger age, you're really disrupting some of those pathways. The pruning process, which is our brain's natural ability to snip off different neurons, and when there's an excess of neurons, so that there's not this kind of hyperactive, hypervigilant state. And the more you use a particular part of the brain, the more likely perhaps it is to be effective. And so if you're disrupting those developmental processes and the pruning process, it can impair those neurons and those pathways used in memories. And we also know that memories are made through meaningful association. So how can I make a memory go from short-term to a long-term is often if it's associated with an emotion, some sort of meaning for me, with some sort of nuanced detail that allows it to be memorable, for me to remember something I did 20 years ago. And so for those memories to become consolidated, we know that you have to have these pathways functioning properly. And if you're acutely intoxicated all the time, having meaning and even short-term meaningful memories and emotions and connecting them all and then consolidating those memories, that may become more difficult. And one more question. Are there particular dangers with vaping marijuana? So what we know about vaping, also on the rise, and off the bat, there needs to be a lot more research in vaping. There are no robust studies. Vaping devices keep changing. It's almost impossible to generalize findings, and we don't know enough yet. That being said, we do know that it's less regulated. It's obviously harder to smell. There are different scents now that almost smells like incense. It doesn't have that classic marijuana smell the way that you would, the one that you would have if you were smoking marijuana. We know that it's easier. There's easy access now. In New York City, you can almost find it in every other block. You can find vaping stores and paraphernalia. And we know that when you're vaping, that there tends to be a higher potency of THC. And again, that may mean you need less to have a certain effect that person may be seeking, whether it's, I like the feeling of being high, it makes me feel less anxious. But that's a lot of responsibility put on that particular person. Like I said, if they're a teenager, Their brain is still developing, and maybe they shouldn't be making such meaningful decisions at such a young age, and there should be some monitoring. Because the risk is that it is more potent, and they can also use a lot more. And then they get more tolerant to those higher doses, and they use more, and they use more, and they use more. And vaping, we know a little bit of the difference is that it does release the main components of the marijuana plant, but it does that before combustion. So before the marijuana plant undergoes combustion. So that's a little bit different than smoking marijuana. And there was a small study in California where they looked at about 57 concentrates that were examined, and it was a sample of 57, and they found that about a third of them were contaminated with pesticides. So that just goes to tell you that we don't really know what's in these oils, and when you're vaping them, it's a lot of trust that goes into the people that are making it and the place you're buying it from. So that's just something to keep in mind. So on behalf of the Child Study Center, thank you for joining me today. Once you leave the webinar, you will receive a survey, and we would appreciate if you would complete it. You'll also receive a follow-up email within a day or two with a link to a recording of today's presentation. We hope that you can join us for our next webinar, Studies Show What Exactly, with Christina DiBartolo, and that's on Tuesday, April 10th at 1 p.m. And I really want to thank you for joining me, and I really appreciate all your questions. I'm sorry I couldn't get to all of them, and I hope you have a good day. Thank you.